So there are two new QOF indicators that cover obesity, and these came into effect from April 2026 under the latest version of the GP contract. So we have BO004, and what this indicator does is measures adults who are living with obesity and need to be referred into weight management programs. So the patients that are eligible for this are those over the age of 18 with a BMI of over 30, and then we have a 27.5 BMI for patients from South Asian, Chinese, other Asian, Middle Eastern, Black African and African Caribbean family groups. So what practices must do is refer these patients into a weight management program within 90 days of the qualifying BMI being recorded within their patient records. And we have tier 2 and tier 3 services that practices can refer these patients into. So tier 2 is weight management programs that align with the NICE guidance. So meaning they must have a coordinated package of dietary support, physical activity support and behavioural. So the programs must include clear and defined measurable outcomes for our patients. So examples of these services, we have two national services that are available for practices to refer into. There's the digital weight management program, and then there's the diabetes prevention program, and then there are local authority commissioned lifestyle and behavioural management services that practices do have access to. And then the tier 3 services are specialist multidisciplinary weight management services for patients with higher clinical need and complexities, and those are surgical pathways. Then we have the second QOF indicator, which is OB005, and that is focused on shared decision making, behavioural support and prescribing of weight loss medication for the high risk cohorts. So we have cohort 1, which started from June 2025. That is again patients aged over the age of 18 with a BMI of over 40 and 37.5 for the ethnicity adjusted groups. They must have at least 4 out of the 5 weight-related comorbidities. So you've got type 2 diabetes, hypertension, dyslipidemia, cardiovascular disease and sleep apnea. And then cohort 2, which started from June of 2026, again is patients aged over the age of 18, and this is a BMI of over 35 and 32.5 for the ethnicity adjusted groups. And again, 4 out of those 5 comorbidities which are just listed in cohort 1. So practices are invited to invite patients in cohort order. So we do ask that you please ensure that all patients within cohort 1 are invited and before starting cohort 2, and use risk stratification approach if needed. So what do practices need to do to make sure that they're achieving this indicator? So there's 3 steps. So there's the shared decision making conversation about obesity management, the offer of the prescribing of the NICE approved obesity medications, so GLP-1 is available and an appropriate treatment, and referral to behavioural support weight management program. So I will just touch on the weight management program in a bit more detail. So there is a weight management program wraparound service available to patients within the local area. So while it is a national delivered service, locally our provider is Reed Wellbeing, and if practices don't have the information to be able to refer into that, then please do reach out to the primary care team in the ICB, but we have made sure that that has been distributed out to our practices. So QOF is funded through the normal national routes, so practices are aware of how they receive their QOF payments. So just to touch on what the point and the achievement thresholds are for these two QOF indicators. So for 004, this is worth 5 QOF points, and there is an achievement threshold of 10% to 30% for eligible patients. And then 005 is 13 QOF points with an achievement threshold of 50 to 80% of eligible patients. So the ICB did recognise that practices would require some additional support with the rollout of these QOF indicators, and certainly with the BO005 QOF indicator. So what we did is we included an indicator within the local QIF, which was to support practices with implementing this new QOF indicator. So what that QIF incentive asks practices to do is to embed that new QOF indicator during 2026 to 27 and follow the guidance set out. So the guidance requires practices to ensure patients are eligible in line with those cohorts that were set out by NHS England, adhere to the NICE guidance and the appropriate prescribing, ensure counselling takes place before treatment begins, ensure that patients are aware of their expectations and to engage and complete the behavioural wraparound programme, identify any implications requiring referral or admission, or risk that requires a change in management plan using the switch service, signpost or refer patients to psychological services where this will support their outcomes, and profiling eligible populations to understand their needs and response. So develop approaches for inclusive access and engagement with weight management to reduce any health inequalities. So practices will be expected to run the clinical searches to identify eligible patients within those cohorts 1 and cohort 2, and then use the clinical templates to record any consultations, outcomes, etc. And that will ensure then that practices will get paid for that element of their QIF. The weight management element of QIF is funded at 20p per head of a practice registered population. So practices will be paid at 80% of the total award for full achievement of the framework in monthly instalments. So once all evidence is reviewed, final achievement will be calculated for the practices. So practices will receive any outstanding money owed to them. However, where practices haven't quite met the achievements within that QIF, they will be asked by the ICB Finance to repay that money back.